Hi all, welcome to today's webinar. My name is Peach Robb and I'm an HDR student at Sturt University, but I'm also a member of the HDR community of practice at the Manna Institute, and I will be moderating today's webinar. So welcome. Before we start, I just want to do an acknowledgement to country. So Manna Institute respectfully acknowledges the First Nations people as the continuing custodians of this continent and pays respect to elders past, present and emerging. The Institute honours their rich cultural heritage, beliefs and enduring relationship to the lands and communities in which we live, learn and work. Today, I come to you from Gundungurra country, and please feel free to mention where you're joining us from today in the chats. Manna Institute is a virtual institute formed by regional universities network known as RUN, which is made up of the 7 universities: University of New England, which is the lead university, Federal University, CQU, Charles Sturt University, Southern Cross University, University Sunshine Coast, and the University of Southern Queensland. And our foundation partners are Everymind, Lifeline Direct, Lifeline Research Foundation, and the Centre for Mental Health Research at ANU. We at the Manna Institute, we have some of the leading researchers and industry partners who are working with rural, regional and remote Australian communities to improve mental health and well-being. And the Manna supports meaningful research, fosters the development of professional workforces and translates research findings into practical place-based programs. And now today's webinar is going to follow the general pattern of previous webinars. We're hoping to make it a really nice conversation between our speakers. And this is a topic that's really important when thinking about regional, rural and remote mental health. The topic is engaging with rural communities. So we've got 3 speakers today who are going to share some of their knowledge and experience. And the first speaker will be Dr. Hazel Dalton, who's a Senior Research Fellow of Rural Public Health at the Rural Health Research Institute at Charles Sturt University, and she's based in Orange. Hazel's research interests include rural place-based health services research and collaborative approaches to community wellbeing and suicide prevention. She chairs the Rural Behavioural Health Special Interest Group of the Global Leadership Exchange, and she led research at the University of Newcastle's Centre for Rural and Remote Mental Health for 6 years. Also talking today is Susan King, and she's the General Manager of Crisis Support at Lifeline Direct. Susan brings a warm, engaging professionalism to her role, leveraging over 20 years of experience in telephone and remote delivery of mental health and social services. She's passionate about making a difference. Susan focuses on strategic leadership, fostering collaboration and improving operations to ensure our mission resonates with the community and effectively supports vulnerable individuals. And then thirdly, we've got Cath, who is based in northern New South Wales and leads the community engagement team for Lifeline Direct, whose footprint includes the far north coast of New South Wales, the New England area, Newcastle, the New South Wales Central Coast, Western Melbourne and southwestern Victoria. Cath has worked with Lifeline Direct for just over 5 years, and her current role includes delivering, maintaining and growing community capacity building activities, collaborating with external funders, government organisations, people with a lived experience and other relevant stakeholders to identify and implement suicide prevention and fundraising initiatives, leading and participating in several suicide prevention networks. Cath has a background in special education, adult education, and capability in workforce development. She then moved into her first role with Lifeline, coordinating one of the national suicide prevention lifespan trial sites, a national initiative focusing on regions with higher than average suicide rates. Most recently, Cath has successfully led 2 disaster recovery projects following the devastating bushfires and floods in northern New South Wales. Cath and her team coordinated training for almost 2,800 people in suicide prevention and wellbeing, skills for life programs, and supported communities across 10 LGAs to access targeted support and effective mental health referral pathways. Her presentations at the upcoming Manna Symposium in December and at the Engaging with Rural Communities webinar in August will focus on these things. So these are our 3 speakers, and as usual with these webinars, we're really looking forward to a bit of a conversation. If you've got any questions, please feel free to write them in the chat or to wait to ask them when we finish recording. So we might open with Hazel, who's going to talk to you all today. So Hazel, take it away.
Thanks, Peach. I'd just like to acknowledge that I'm coming today from Wiradjuri country. I live up in Orange, and I want to pay my respects to elders past, present, and emerging. So thank you. I've just been rethinking what I would say after listening to those wonderful introductions. Maybe a little bit of a history lesson. Whilst I was at the Centre for Rural and Remote Mental Health, I actually began in a research support role, having changed my research interactions from moving from Adelaide to Orange in 2012. I moved from active research in biological discovery science into research support in a medical school, and discovering that health and medicine are quite different from biomedical research. I came to work at the Centre for Rural and Remote Mental Health and found this place that had a community advisory committee. They had active programs in community, and they had this research arm, and there was this flow between research feeding programs, people in programs and community feeding research, and it sparked back my interest and engagement in research, and I ended up hopping back over the fence in 2016 to become the research leader. And I guess it sort of set about a challenge and a thinking of how research could be done differently, and I've taken that along. And I guess one of the pieces of work that we did in 2019, I think it is, a collaborative piece of research with a number of researchers and health services people really engaged in rural mental health, was the Orange Declaration on Rural Mental Health. And it was a commentary, a thought piece on 10 themes, 10 challenges and 10 solutions, to which we brought it up to the Global Leadership Exchange on mental health, rural mental health in Washington in 2019, and found that there was great resonance internationally. So there was this connection to, we'd really written it from an Australian perspective, but there was this engagement there. And we've continued to work with this collaborative group internationally and grown. So I guess the piece of work I wanted to talk about today has sort of been born from those conversations, as well as the inception of Manna. So whilst we were at the Centre for Rural and Remote Mental Health, we supported the building and inception of Manna, and that's been a really exciting development. And one of the things that I had as a bit of a cautionary thought was, what happens when you have suddenly this influx of money, new people coming in, going, yeah, I'm going to go do this work. And you go, what would it be like to bring some of those lessons learnt from our perspective, and also to allow people to start well, but also to not just go, well, I've got this experience, what else do our collaborators, and what's the wisdom around us? So we set about a process of waves of workshopping and sense checking with different groups. So I collaborated and did work in Australia, but we also had work done in Ireland, in Scotland, in the States and Canada, and some input from Sweden, New Zealand, and Spain. So a bunch of collaborators essentially come together to put a commentary around guiding principles for rural mental health research. And I guess the main things are about, how do we avoid some of the pitfalls, but how do we do best practice as well? And to frame up around those, I guess co-design is something that's well established and well regarded. And I think we know what it is in mental health research to include consumers and carers. I guess what we're advocating in this space is also to not forget that there are place-based experts, people with a lived experience of living in place, and those with the expertise, practice-based expertise to include as well. Another principle amongst it is really one of beneficence, which is there in ethics anyway, but really thinking about what is it to make sure that you're giving as well as getting? And moreover, can you make sure that you're giving first? And I think maybe one of the ways that that could be framed is actually in knowledge translation and exchange activities. So as you're developing things, hopefully you're building skills with your partners, but also that you're considering of the products of your research, even the interim ones, is how can you share that knowledge both in talks and workshops, but also in different kinds of written formats and summaries or tools that you develop together, but thinking through more about how it can be an exchange and a collaboration where there's active benefit in the community, irrespective of the kind of paper you hope to get at the end. What else do I want to frame up for you? There's probably something that most people on the call will understand is that rural communities may, if you do this well, you will build trust. If you do this poorly, you can undermine trust. And that's not just with you, but also potential future researchers. So there's a custodial aspect to this of remembering it's not just about you. And hopefully, if you live in a rural area, you have that deep respect of, well, if you're not going anywhere, you're going to run into someone in the supermarket. You have a different kind of face about what kinds of research is acceptable and how you want to go about these things. So anyway, this paper is coming out soon. I'm assured by Russell, who's one of our co-authors, and we will share it on the links when we can. I don't know if I want to go on some more or I can leave it open to conversation. But I guess one of the things that's exciting for me when Liz framed up the webinar, she said, do you think you'd like to have someone from community and someone from an organisation come and talk? And I said, given the nature of what the paper's about, it would be ridiculous if I said no. So I'm very excited to hear from Cath and Susan, and maybe I'll throw over and that way we can have some conversations.
Thank you so much, Hazel. Cath, do you want to introduce yourself and go from here?
Jump in. Thanks, Pete.
Thanks.
Thanks, Hazel. And yeah, there were a couple of things you mentioned there which really resonated with what I'm going to talk about. So I'll start. And yeah, I suppose the idea of the webinar is that hopefully there'll be enough variety in the presenters that everybody gets something useful from it. But I'm already knowing I'm going to learn some things from Hazel and the paper that you've been referring to. So some good connections made. So as Peach said, my name's Cath Bird. I'm the head of community engagement for Lifeline Direct. I'm located in northern New South Wales, up on the north coast. So our office is in Lismore. And I was just telling the others when we were getting ready, it's really hot here today, which is wonderful, but it's only August, and that's weird because we stay really, really hot right through until February and March. Anyway, it's lovely to be online, and thanks so much to Manna for inviting me along. What I thought I could talk about today is, I could talk for hours, but because it's such a great group, I had a look of the participants we've got there, is mainly to talk about a big project that we had that was called the Recovery and Resilience Project. It was in response to the 2019-2020 bushfires. And it was funded through the Commonwealth Department of Industry, Science, Energy and Research. They lost one of those portfolios along the way. I don't know if they've got energy in there anymore. But we were one of, something like 500 projects that were funded through that particular Black Summer bushfire round. We were very aware when we were progressing with the project that we will probably never get access to such funding again. It was a time, I think, where government departments were really in a quandary about what to do with the climate disasters, and they threw money at it. we were thrilled, absolutely thrilled. So to be able to give you a bit of an idea within, have I got 10 minutes, Peach? Will you give me a bit of a wind up when I'm getting close?
Absolutely.
Thank you. It'll be a monumental summary effort, but I'll do my best. So this was a project that was almost the second iteration. We had what was called Bushfire Recovery 1.0 a short time before in a much smaller way. So this project, we were funded to deliver mental health and wellbeing support, to support resilience in all of the communities, in several communities that were affected by the bushfires. So this went across 10 local government areas, 10 LGAs on the north coast of New South Wales and out into the New England area of New South Wales. And without a shadow of a doubt, it was absolutely a resounding success. It was I felt so privileged to be part of this. And there's a couple of my team who are on here today. And we were funded for about 2 years, but in reality, we rolled out activity and implementation over just over a year and a half. The first portion was recruitment. And any of you who've have been in that recruitment space, you know how laborious that is, but it is so worth it because you get the right people. So what we did, we had, there was my role managing it. There were 2 coordinators, and then there were 10 what were called community advocates. And they were really our secret ingredients. So those people were employed on a part-time basis in the 10 LGAs. And we very deliberately didn't ask for mental health qualifications when we were doing the recruitment. We wanted people who had great networks, great communication skills, and some experience around the disaster recovery. So we had the most diverse group of people. Some were semi-retired, some were students doing psychology at university, some were connected to Lions clubs, rural fire brigades, school P&Cs, you name it. There was nurses, there were teachers, everybody. And what was crucial about their role was they were embedded in those communities. So when Hazel was talking about the trust, it was absolutely critical, and it made the initial commencement of the project easier because they were trusted, well-known people in all of those small places. And what we made a real effort to do was to roll out the program more than just at the sort of major towns in those LGAs. So we actually were able to hit really tiny, small communities, some very diverse groups. And the main kind of thrust of it all was a couple of pieces. One was around conversations and events that we attended and delivered and ran. And a huge portion of it was around training. And so we rolled out a suite of 5 or 6 different programs, very new to a lot of those communities. So with the suicide prevention focus, we did Safe Talk and Assist. So the half-day suicide alertness one and the 2-day suicide intervention one of Assist. We did accidental counsellor and a few different variations of it. Another brilliant one called Mind Your Mates. And we also did one called All About You, which is around self-care and mental health first aid. And then towards the end, we were able to introduce a couple of what's called DV Aware. So the program, it took off. Tricky to start with because a lot of the people who were our community advocates were known in their community as somebody else. And so now, but they all found, once we got the branding and they all got their Lifeline t-shirt, they had to be very mindful of where they wore their Lifeline t-shirt because people just, you have Lifeline branded all over you and people just open up and tell you all kinds of things. And so they were instrumental. But in amongst all of that, so we developed some we co-designed some documents of shared understanding and some different flyers and great collateral, fridge magnets and postcards and flyers and all kinds of things. But in the background was this crucial team of people helping behind the scenes. And that was the training team. So I believe June, our training manager, and Lisa, who was one of the coordinators, is online today. It's a huge machine going on to roll out one Safe Talk program in one small town it's massive. So behind that, there's the registrations and all the administration. There's the venue, there's the catering, there's the trainer, there's the availability that suits the community. There's, of course, our payroll team and our finance team and all of the HR and everybody kind of ticking along behind it. So, yeah, it was a real privilege to be involved in it. We had some great evaluation pieces. So the University of New England were able to evaluate the project. They came in quite early on, and at different points along the way, we conducted surveys, monthly surveys with the team, some community surveys, and then some focus groups, and produced an evaluation report. So how are we going for time, Peach?
We are getting very close. I was just about to say.
Thank you.
But what an amazing initiative, though.
Yeah, look, it was an absolute privilege to be involved. It was so terrific. It was incredibly emotional when it finished up, because all of the team, it could have gone on and on, but of course it was a project with a very finite funding attached to it and time period. We do have a little video that I was going to share, but I'm happy to either try and do that now, Liz, or maybe after Susan. I don't mind. It goes for about 3 minutes, and I thought it might just break things up so you're not all listening to me talking all the time. So we'll
I think Liz is going to share it now. So
a few seconds before the sound kicks in. I can't hear any sound. I'm not sure about anyone else.
no, it doesn't seem to be showing sound.
We can always send it as a link. I think that's Liz beavering away behind the scenes.
Shall we throw to Susan and come back to the video, Liz? That might be the best bet while we work out what's going on with the sound. And yes, worst case, we can just share the. Gosh, I just accidentally muted myself. Hopefully you're able to hear what. Yes, we'll throw to Susan, and then yes, hopefully we'll be able to fix the muting on the video before the end anyway. But Susan, yes, take it away.
Right, thank you, Peach. Good afternoon, everyone. So my name is Susan King. I'm the General Manager at Lifeline Direct, and we focus on delivering crisis support, counselling and training to communities across Australia. And we've got a very broad reach through our national helpline services, but also a strong local presence through our regional centres. Locally, we offer face-to-face counselling and, as Cath mentioned, the Schools for Life training for community gatekeepers. And our community engagement teams work closely within local communities to increase the impact of our services and respond to emerging community needs. So today I wanted to explore how you as researchers can effectively harness the resources of service organisations to amplify the reach and the impact of your working community, how to reach key decision makers and tap into their community knowledge and leverage the trust that they hold with the communities, and how those strong collaborations with those local organisations and service providers can ensure that your research engages with the local community and also delivers tangible benefits to the community. So I'm hoping to make this very actionable for you as well, and give you some takeaways to take back with you. So let's start with how we harness the resources of the service organisations. And really the first step is to find the right contact within these organisations. And this can sometimes be challenging, because sometimes the most familiar contact might not be the best champion for your cause. So utilise the relationships you have, reach out to those familiar contacts and ask for introductions to advocates within the community. And you really need to be clear about what you need from the organisation, whether it's access to specific groups or support for dissemination, and have a clear, defined request that helps others understand how they can assist and also why it matters. and really focus on identifying and engaging with the decision makers and influencers. So these are the individuals with the authority to advocate for your research and connect you with community networks or service users. And be mindful that these stakeholders aren't always the people that will be your point of contact when doing the doing. So it's really important to keep these stakeholders up to date with how things are progressing so that they can continue to advocate for you. Another of the key ways that organisations can help you engage with rural communities is by helping you build trust. One of the biggest challenges that researchers face is that they often will have only brief, intermittent engagements with rural communities if they're not researching in their own community, making it difficult to establish that trust that's essential for meaning collaboration. And service organisations such as Lifeline often have deep roots and strong credibility within their local communities. And that's something that can be incredibly valuable for you as researchers. So leverage that local expertise to identify community leaders and influencers and ask them to make some warm introduction. And that borrowed credibility can help you establish some trust and support for your research and help you get some runs on the board. We also want to leverage service organisations to align research with community needs. And aligning with community needs, of course, is essential for meaningful impact. And we can achieve this by collaborating closely with service organisations who possess the connections and also the valuable insights into the community. Into that place-based knowledge. Service providers can often act as a crucial bridge, ensuring that your research is both relevant and grounded in the real-world context of the community. And that effective alignment, as Hazel mentioned, happens through co-design, through jointly developing research agendas that address the genuine needs while leveraging that local expertise. But this alignment isn't without challenges, particularly for service organisations. They often face resource constraints, time pressures, making it difficult to accommodate research priorities and integrate studies into their ongoing programs. And to overcome these challenges and create true synergy, it's really vital to find the common ground and focus on the shared objectives, and most importantly, minimise disruptions to service delivery. But by working together in this way, researchers and service organisations can ensure that their efforts leads to outcomes that are both impactful and sustainable. And finally, investing in the relationship with community organisations after the research wraps up. So communicating your research findings clearly and really practically to your key stakeholders, help them to digest and translate the findings into tangible outcomes and also meaningful service delivery improvements by really tailoring your findings to the specific needs of the organisation. So these are just some of the ways that you can sort of leverage the resources of community organisations and really enhance the reach and impact of your research. By identifying the right contacts, building that trust, engaging with the key influencers and really aligning your research with both the community needs and the service providers' goals can really ensure that your work really meaningfully engages with the community and has some tangible outcomes. I'll hand back to you, Paige. Maybe Cath's got that video ready to roll.
Thank you so much, Susan. That's really interesting, really great advice. Yes, I think Liz has got the video. She's just going to play it. So yes, this will be really interesting.
There's so many parts of a proposal and a project like this that has to come together to make it actually work. We have an amazing staff at Lifeline, whether that's the community advocates on the ground, our tireless team behind the scenes that put all the pieces together to actually make it work. A funder like the Australian government that shows some flexibility and understanding of a project and how it rolls out. And of course the community willingness to be part of it and to be passionate about their local communities. All those things come together, and so without any of those pieces we can't have contributed or done any of the work that we've been able to do through this project.
When the fires first broke out, we were a little unsure of where they were, but most of us woke up or came out one afternoon and could see the entire sky to the south full of flames.
All the volunteers, all the firefighters were there that day. They sort of couldn't believe they'd ever seen anything like it, and hopefully we don't have to see it again.
We knew it was going to be catastrophic. What we didn't realise was that we were nowhere near prepared. Lifeline's just been a massive support, and then we have places like Hazel together, we have the CWA, all of the volunteers. Those people in Lifeline, they provide a connection for us to all come together.
We're able to give out some resources to give them information, some phone numbers they could call, some questions that they could ask.
What do you need? How can Lifeline help? We've got training, we've got information sessions, we've got our crisis support services. What is it you need? And then they gathered all that information in and fed it back and said, right, this is what my community needs.
The training programs are rolled out across the footprint of the fire grounds, targeted at the communities that have been most affected by the bushfire. Courses that we have really cater to the needs of the community to help with the recovery, as we've targeted particular communities that have been most affected and taken the training to those areas.
Lifeline have been amazing. They basically made this position available in my community to bring training and awareness about Lifeline services. So learning skills, knowing that we can ring 13 11 14 and talk to them about what's happening. As a frontline responder, to ring up and to hear the words "I'm listening" is an incredible invitation to talk about what's impacting us, and that process allows us to continue to prepare for successive natural disasters.
The important thing for us to remember is the significant impact of the fires will be felt for years to come, and Lifeline will be here for you always.
Thanks so much, Cath, and thanks, Liz, for playing that. It's so interesting to see that from that perspective, and how important it is to offer that training on the ground, and connecting with the people that are actually in the areas. I imagine it, it's a very different thing from being in another town or in the city, and and disconnected from the affected people.
Yeah, I think also too, Peach, people, one of the things that we heard time and time again was how that some of those tiny little communities had been forgotten. And it might not even have been that they needed something from Lifeline. They might not have connected and come to our training, but they just needed someone to listen to their story. And that was some of the training we did was in incredibly remote places. And we had some great, really funny stories about where the trainers had to stay in order to access some completely off-grid communities who didn't even want the training promoted outside of their community, because it was very important to them that nobody else sort of knew about it. But I think you're right. And it's what Susan was saying as well, and Hazel, around all of those different connections. And that's probably what will be a great thing that can come from this, is that if it can help university researchers and students studying around how we can connect you perhaps with some different communities, because there's already that trust there, and it's kind of got to keep the momentum going. What's not great about funding funded projects is they have this, start and end date, and we don't want to disappear. So yeah, video was a great little addition. Thank you.
Yeah, no, and as you say, Cath, it's an interesting one. Researchers might not be just conscious of how different, and the different comfort levels of of contact with the community, and and having that to that conduit is hugely beneficial.
I have a question for Cath, if that's okay. I can't help but observe when you were talking before, you highlighted I guess, the back end engine that it takes to do really good engagement, you know, so that the champion on the ground is well supported. And I guess part of it is I'm foreshadowing, you know, if someone's thinking about research, is how do they adequately resource and plan for the fact that this doesn't happen. And there's this need to scaffold and really think through all of the components so that you can really empower people on the ground. And it means that it's not that you do less work, you do more to be wrapping around with the engagement, the evaluation support, the resourcing, and that sort of creative ways of responding flexibly when they say, no, not like that, we want this. And do you want to speak more to that side of things?
Yeah, I think, thanks, Hazel. It was a real part of it, I suppose. And that was a challenge when we were wrapping up, because we had to have, the team had to have what were very difficult and at times, as I said, emotional conversations. And the legacy you leave behind is so important, and that's why that those community members, what we call the advocates, what they are now doing, even though they're not working for Lifeline anymore. There's a bunch of them out in the New England area, and they still get together and have lunch, you know, once a month. I think they were going to try and do. They kept a lot of the Lifeline collateral that we had. They still distribute it. They still connect with the communities that they were responsible in kind of setting up little almost communities of practice, but in a less formal way, I suppose. Yeah, but I think it's absolutely an integral part of that engagement and community engagement. You know, it's difficult to measure. We had some KPIs that we nailed, and they were around training and the number of people coming, the number of sessions, the numbers. They were kind of like the conversations, the occasions of service, and the touch points. But what was difficult to measure was the social capital side of it, and how, what's the legacy, I think, that's left behind.
Thank you.
Thank you. Now, I just want to say, yes, Susan, did you have anything to add to that about?
I was actually hoping to tap into Hazel's knowledge when you talked about that sort of knowledge exchange as one of the principles of the research paper. Can you talk a little bit more about how researchers might work with organisations to make sure that knowledge exchange is done well?
Sure. I guess I had a living lesson when I was at the centre about, you know, what would be good, and each time you're going, what would be better next time? And then coming across a whole body of literature about knowledge translation and implementation science. So I guess one of the things is there's a framing around it from the Canadians, which would be integrated knowledge translation, or if you talk about it as knowledge translation and exchange, because it's two-way, it's this idea that you, in your planning, you start to go, what does the sharing look like along the way, and how do we have the conversations, and how do we get savvy at documenting that, but planning for it, to know that this is an expectation, as opposed to that thing later on where you go, oh, so we'll go to one of your conferences and talk about our stuff. That's not what I mean. It's that lived and living experience of working with. And so those things are the regular conversations, and of actually being responsive when someone says, you know, we really could do with X, and how do you, even if it's a little bit tangential, how do you build in time and brain energy to do that? I think one challenge for researchers is that can feel a little uncomfortable. It can be the drawing your findings before you're ready. What's good enough information, or what's good enough for now? What is it for the audience? And your audience aren't researchers. Therefore, what does plain language look like? So I think it has to be an embedded part of the process. I do think now, though, for funding, it's important. So there's actually recognition of the value of this, and if you're deliberate and you showcase it and you resource it, you can put this in your funding bids. It's not merely the stuff you do on the side to keep you guys on side. It's actually how you get to impact. So I think there's probably, it's a more receptive environment than it ever has been, even though it's more competitive.
Thank you.
So do you find that, researchers and academics do find it challenging to change that language and to change the way that they present that content back to the community?
Can be. Different people find it more or less comfortable. So we just were at some training workshops last week with a really good qualitative researcher who pointed out that for those who like just the numbers, having a qualitative person on side for those things can actually be the framing around, well, what's the theoretical underpinning, but also what's the knowledge translation opportunities of your particularly, very academic and quantitatively driven data. So I suppose there's opportunities there. I think I've just lost a thread there, Peach. Coming back. That's one part.
It's very interesting kind of look, the difference between you, and obviously this is the conversation, is how to translate and how to, use meaningful language in the context that it, in the community context.
I think it's in two contexts. One is for other researchers. So if you're doing collaborations across disciplines, the more plain speaking you can be, the better off you are. And that takes a little bit of experience and confidence to, have the flexibility of not just clinging to your tribe and saying, well, these are the words they use. I've got to feel safe in that. So that's one aspect of being generous and being understood. But you should be able to talk to, your neighbor or someone else about the work that you're doing. So thinking about it that way of saying, what is it to take it to clear lines? And some of it will be about workshopping the information with others. So reaching back to my prior experience, we used to field test our sort of plain language summaries with those involved in the programs, but also the admin team and anyone in our organization. We'd be like out going, all right, how does this work? And you'd get feedback from the finance person, from the person at the front desk, and they would often have valid feedback which called you out and said, what does that mean? And it was really helpful. So I think that thing of the perfect thing that you create is only perfect in your mind. So you have to go out and test it and have an exchange and then finalize it once you've had a bit of feedback. And that's another way of engaging the community too, because you can bring it saying, we're thinking about this. How does this work for you? And use that as a way of sense checking and validation.
And I'll just jump in there, Hazel, to attest to that. When the University of New England team were helping us with the evaluation, that was exactly what they did. So Sarah and the team, because they were surveying and checking in with us every month, those questions in that survey were refined. And then when they were prepping to do the community survey, it was the same thing. My team were able to go, no one where I live is going to know what you're talking about there. Just pare it right back and, make it as user friendly as possible. And they were absolutely receptive to that and took it on board.
And that speaks to really good research practice too, though, because there's nothing worse than, going through all of that hard work and effort to put out your survey into the wilderness and find out that people misunderstood what you meant and you haven't given them any scope to feedback and what does it look like to build in so you can actually catch when you've missed the audience. I recently participated in some research where they asked me to report on a number of measures and I had to answer everything. So everything was compulsory and there was no free text chat for me to go, I didn't think I could fully say about, I didn't have any, and I felt frustrated. And even, just for satisfaction, it might have been helpful. Sorry.
No, I was just going to say, did any of the three of you have any other questions for each other?
I guess I wanted to make a comment and an observation was that Lifeline is such a trusted brand and community, and it has such a long history of being helpful in this space that, kudos to you, and I can understand it, but I probably would also imagine that for us as researchers, we want to be making sure that we're coming in as respectful engagers, knowing that you are gatekeepers too, where you might respectfully say, yeah, that's not going to fly in this patch, and we will respectfully say no. So thinking, and sometimes it's going to be completely valid too, like where you have to take it on the chin as it's not suitable or not now, and those kind of things. And hopefully, building those relationships where you can come back at a later stage going, does this fit or can we help?
Yeah, and that's something that Lifeline is always wanting to be, responding to the community need and being as helpful as possible. But you have to have real discipline in saying, no, that's not quite in our wheelhouse. and perhaps, tapping into, some of the community that, Cath's aware of. We can put you in touch with the people that, it is in their wheelhouse. But yeah, it's important to develop those relationships so that, you can come back and, have continuing conversations when you have got the right research program. Yeah.
And it was one thing we really emphasized with our team was around boundaries, because, probably the majority of them applied for the role in the first place because they're kind and caring people and they wanted to better support their community. And then they saw the Lifeline brand and they were like, oh, we're all going to be counsellors, or, and we had to go, hold on, this is your role. And, and it's really hard to not fix everything for everybody. But, part of this project is around referral pathways, and we do as many warm handovers as we can, and that's when we would pivot to Suze and her team and to talk about, there's all the Lifeline crisis support services available, but there's all these other things in your community as well, and not one person can answer and fix everything. So just you got to kind of rein it in a bit, and they were on board. It was hard.
Sure. I guess one of the other challenges I'd raise, and because you've highlighted it as a time limited project, so that's not strictly in your mind researcher projects, but a lot of researchers will find themselves faced with time limits and ambitions that are bigger than their allotted time limits. So that thing of managing when things will end is actually, I think, a real thing. Like we got to a point where some things you would say no to because you go, well, it's ridiculous. You can't actually do that in that time, not in a meaningful way. And I guess the cautionary tale of how do you encourage people to do work, because there's not enough research in rural mental health at all. The capacity is very low. There's not enough interest, and actually, because we vary so much from the city, the solutions that are place-based that work, we deserve to get that into evidence so that we say you can have pockets of things that work in a given place, how it is and what it looks like to resource it. So I think from an equity standpoint, I want to champion doing the work, so I don't want to put people off. But there's that little line of how do we think about those things when time is against us a lot of the time. And I don't know what the answer is, but I'm happy for input.
Well, my optimistic viewpoint would be that it's about communicating those bigger research goals that we have, and then looking collaboratively for opportunities where there might be some funding coming up where we can sort of start at the start gates and have a decent time period in front of us to test and trial those solutions. Organisations are always looking for opportunities for to funding, and collaborating with researchers is one way that we can increase our likelihood of getting funding. So knowing those sorts of things that researchers want to trial in the communities ahead of time can help us approach those funding opportunities together.
And I think it's unfortunate that the funding cycles, following a disaster, never match the recovery, resilience, preparedness cycle. Someone termed it the other day, trauma-informed funding cycles would be better than, just, hey, we've got money and throw something at it for 2 years, or mostly it's less. This was a luxury, this one, with the length of time we were able, most of the flood recovery funding that came through after the big Northern Rivers floods in 2022 was very piecemeal. So I imagine in the research, sector and in your worlds, that's such a big consideration. So if we're able to support in any way, as much notice as possible, is
I guess as a plug for Manna and the way it's been built is, I would suggest that that's already built in some of that connective tissue. So I hope it continues into the future. It's really well put together. Yeah.
Well, yes, and on that note, I just want to take a minute because we're running low on time, and we might see if there's any questions for the panel, but just wanted to thank you all, Susan, Cath, and Hazel, for such insight and, you know, and really interesting talks and a great conversation. We might stop recording soon, unless any of you had something else to add before we go. We might stop recording soon and just throw to any participants who have any questions before we close the webinar.